So hey, it's Dr. Esho, you're on my YouTube channel, and today we're going to talk about Botox. Well, actually we should call it botulinum toxin type A. Getting a bit professional here now. Now, Botox is a trade name. It's made by a company called Allergan, but the actual product is botulinum toxin type A. And there's several different ones on the market. So from Botox, which we know it's most named by Allergan, to Azelaic by Galderma, and even Botox as well. And there's several others, but I tend to use Botox itself or Azelaic, and I'll go on to tell you why. So Botox is a neurotoxin, and when we inject that, what it does is it stops the muscles from contracting. Now you must say, well, I just wanted my wrinkles to go. I don't want my muscles to stop contracting, so why am I going to do that? But actually what happens is when the muscles pause, so if we look at my forehead and I can't move here, what then happens is the skin, which is the biggest organ in the body, actually starts to renew and remodel, and the fine lines that were there or deep folds tend to fade and smooth away over time. So that's actually how it gets its action. So the best Botox you can get is Botox that causes enough loss of movement to cause this renewal process to happen, but doesn't make you frozen, looking like you just got your head caught in a wind tunnel. So the best thing is to get a good practitioner to know what he or she is doing. So loads of people ask me so many questions about Botox, but I'm gonna give you the top 3 questions that I get all the time. And I mean all the time. You guys are sending this through my DMs, Twitter, even just shouting at me at the street, Dr. Esho, and this. But I've got this now for you, so listen carefully. So number 1, when will my Botox start to work? Now, Botox is not instant, it's not magic. It is like magic, but it still has to go through a physiological process. Now, usually we say the onset is about 3 to 5 days, and that's how it gets its action. A lot of people sometimes get a bit of a placebo effect. I remember once I was injecting a girl in my chair, and by the time she'd paid, she was going, oh, I think it's working. No, I'm good, but I'm not that good. So 3 to 5 days is the key time when your Botox will start to work. Number 2, will it hurt? No, it's not gonna hurt. Now, I'm not gonna lie, I've seen some people that are absolute savages with a needle and make a simple process like Botox hurt. But actually, if you're in the hands of a good practitioner, like myself, you know, I have to say, we use really ultra-fine needles and it doesn't hurt at all, and it's over within a matter of a few minutes. You know, some people do ask for topical anesthetic, and I'm gonna tell you no, don't be silly, because it's so quick and so pain-free, you won't even know what happened. Number 3 is how long is my Botox gonna last for? Now, Botox itself usually lasts depending on a number of factors. The age of the patient, what dose we have given the patient at the same time, and also if there are any concurrent medication. We'll go into a little bit of detail about that, but we'll talk specifically on average what happens with people. Now, for average, it's about 4 to 6 months. And it usually, as we talked about before, starts its onset on the 3rd or 5th day. It peaks in its action at 2 weeks. And so from that time, you're getting your longevity, and you're getting about 4 to 6 months during that time. And that's when you should be returning your doctor for your redo dose. I don't like the word top-up dose, but redo dose to kind of contain your maintenance. Now, in that, a lot of people get worried and go, if I stop, is my face gonna get worse? No, your face isn't gonna get worse. It just will go back to normal the way it was before. But because your face was so good post-Botox, you're comparing a new normal. So you see it as worse than it was before. So that's the only difference. So I've given you your Botox. What do you need to do afterwards? There's key facts that I'm gonna tell you now that will get the best out of your result for you, and then also for me, because you're my brand now. As soon as you come into my clinic and you have your treatment, I want you to look your best. So please listen up. After you've had your Botox, it's important to be upright at least for 2 to 4 hours post the procedure. The main reason for this is the rule of diffusion. People worry about Botox going to areas that it shouldn't. Now, in practicality, that's not gonna happen, but we know from looking at patients long term that it's better in that period of time for them to be upright and not lying down or leaning forward for a prolonged period of time. The next rule, which is almost the same as being upright, is talking about no exercise. And I always say no exercise for at least 24 to 48 hours post-procedure. The reason again goes back to that rule of diffusion. So we just want to make sure you get the best result with your Botox. So I know it's hard, you want those gains, but let those gains rest for 2 days and then you can be back on it. And finally, I always tell my patients it's important not to be in any extreme heat, and that means tan in bed for at least 7 days post, and also not to have any facial massages in that time, just so we can make sure your Botox is the best. And after that, all you need to do is to make sure you attend your review in 2 to 3 weeks time so I can make sure those results are perfect.